Now we will talk about the spinal meninges, and we start with the spinal dura mater. The spinal dura mater is a prolongation of the inner layer of the dura mater of the posterior cranial fossa of the brain. This spinal dura mater extends from the beginning of the spinal cord to the level of S2 vertebrae. This spinal dura mater is attached firmly to the tectorial membrane of the cochlea and to the posterior longitudinal ligament on the body of the axis vertebrae, which is the C2 vertebrae. But elsewhere in the spinal canal, it lies free of bony or ligamentous attachments. These ligaments and this the tectorial membrane will be studied in later in other lectures. So, spinal dura mater is separated from the spinal canal by a layer of fatty tissue in which lies the external vertebral venous plexus. Knowing the location of this plexus is of high importance. So when you asked where is the location of the external vertebral venous plexus, you say it is between the dura mater and the bony surface. Dura mater are pierced segmentally by the anterior and posterior roots of the spinal nerves and is prolonged over these roots to form a series of lateral projections. The importance of these projections is to stabilize this loose tissue, which is the dura mater. So how the dura mater is stabilized in the spinal canal? Mainly by the attachments. We say attachments to the tectorial membrane, attachment to the posterior longitudinal ligaments, and by the lateral projections of the dura mater with the spinal roots. Now we will talk about the spinal arachnoid matter. The spinal arachnoid matter is supported by the inner surface of the spinal dura. Nothing but a thin film of lymph separates these two membranes. The arrangement is similar to that of the skull. Below the level of the spinal cord over the coda equina, the arachnoid is nothing but a delicate membrane that is supported by the dura mater. But over the spinal cord itself, the spinal arachnoid sends many delicate web-like processes across the subarachnoid space to the pia mater of the cord. So, below the level of conus medullaris and the end of the spinal cord, the arachnoid matter sends processes. Do not send the processes below the level of conus medullaris. Up to conus medullaris, arachnoid matter sends processes. This is very important, and as we see later when we explain the subarachnoid space. So these processes are well developed in the posterior midline when they form the incomplete posterior median septum. Why we say this is an incomplete septum? Because it does not reach the middle of the posterior midline sulcus. Now we will talk about the spinal pia mater. The spinal pia mater clothes the spinal cord tissue and enters the line of the anterior median sulcus. It is prolonged over the spinal nerve roots and blends with their epineurium. It is projected below the apex of the conus medullaris, whence it extends as the filum terminale. So this filum terminale will perforate the spinal dura mater at the level of S2 and descends to the bag of the coccyx. The filum terminale lies centrally within the coda equina but is not classified as part of the coda which consist of nerve roots only. So if you asked in exam if the coda equina composed of both nerve roots and filum terminali, this is wrong. It is composed of nerve roots only. A lateral projection of the pia mater on each side forms the denticulate ligament. This forms a flange which crosses the subarachnoid space and piercing the arachnoid connects the sides of the spinal cord to the dura mater. So this projection will work on stabilizing the position of the spinal cord within the spinal canal. The root of L1 lies at the lowest denticulate. So the lowermost denticular ligament lies just above or at the level of L1 spinal root. The denticulate ligament, filum terminali, and the attached nerve roots serve to stabilize the loose-fitting spinal cord within the spinal dura mater. The yellow arrow is on filum terminali. The red arrow shows us the L1, L2 level when the conus medullaris ends, which is the lowermost end of the spinal cords. Below these levels we have what is called the coda equina, which is composed of the nerve roots only, and the filum terminali lies centrally. This filum terminali, yellow arrowed, will pierce the dura mater at the level of S2 and descends to the back of the coccyx. So, in summary, the stabilizing factor of the theca, the dura mater, and the bony column are the following. 1. Attaching to the tectorial membrane. 2. Attaching to the posterior longitudinal ligament in level of the axis, segmentally piercing of the anterior and posterior spinal roots in their way to pass through the intervertebral foramina, the denticulum ligaments, and the filum terminali. This slide is very important. Now we will talk about the subarachnoid space. As we say, the arachnoid matter above the level of conus medullaris, above the level of the lower end of the spinal cord, sends projections to the pia mater. These projections have a space. This is what we called it the subarachnoid space. So the spinal subarachnoid space is relatively large, accommodating about half of the total volume of the cerebrospinal fluid. This is 75 ml out of 150 ml. We all know that the cerebrospinal fluid circulates in the subarachnoidal space of the brain and the spinal cord. Half the volume of this fluid are in the subarachnoid space of the spinal cord. It communicating through the foramina magnum with the subarachnoid space of the posterior cranial fossa. So the subarachnoid space of the spinal cord communicates with the subarachnoidal space of the posterior cranial fossa. Some cerebrospinal fluids percolates away along the meningeal sheath of the spinal nerves. Below the level of the conus medullaris, the subarachnoid space contains only the coda equina and the filum terminali, and it ends at the level of S2 vertebrae. Now we will talk about the lumbar puncture and how we anatomically do a lumbar puncture. Lumbar puncture is done when there is no spinal cord and when the larger volume is the subarachnoid space, and when the vertebrae are in a flexed position. Lumbar puncture is usually done at the level of L3, L4 or L4, L5 vertebrae when the patient's back is fixed, usually when cured up lying on one side. When we insert the needle between L3, L4 or L4, L5 vertebrae, this needle passes through the ligaments of the vertebrae. These ligaments, as we say before, we'll study them later. Just now, remember these ligaments. We may pass through the supraspinous and interspinous ligaments and through or between the ligamentum flava. Since the spinal cord ends at the level of L1 vertebrae, it is in no danger. Lumbar puncture do not penetrate the posterior longitudinal ligament. This is the lumbar puncture. In spinal anesthesia, the anesthetic solution is injected into the subarachnoid space with the needle in a similar position to that used for lumbar puncture. So, mixing with the cerebrospinal fluid surrounding the nerve roots and percolating into them and do its anesthetic action. In epidural anesthesia, commonly used in childbirth, the solution is injected in a space called the epidural. So we don't pierce the dura mater. The solution is injected into the epidural space without penetrating as far as the dura, so that the solution can infiltrate through the meningeal sheath containing the lumbar and sacral nerve roots. The approach is similar to that for the lumbar puncture, but formerly, through less common now, an alternative approach was into the sacral canal through the sacral hiatus.